Good morning. Today's session we will see evidence-based medicine pharmacist perspectives. So what is the definition of evidence-based medicine? Evidence-based medicine is the conscientious, explicit and judicious use of current based evidence in making decisions about the care of individual patients. So what are the components of evidence-based medicine? It is the proper clinical judgment, relevant scientific evidence you will have to collect, and patients' values and preferences you will have to follow. So that forms the basis of evidence-based medicine. So it is a final decision-making process for implementing the best treatment plan for the patient according to the external medical evidence that is compatible with national health policy and patient factors. So what are the steps to practice evidence-based medicine? So first you will have to ask the answerable query. For example, like, does aspirin reduce the risk of death after a heart attack? Then translate them to effective searches for the best evidence. So search for the relevant evidence, suitable source you need to locate. Then once you locate that particular source, you will have to critically appraise, that is good quality that applies to the patient's circumstances based on your query. Then apply the evidence, then evaluate the performance. So what is the best answer you have got ultimately? That will form the evidence-based medicine or evidence-based practice for whatever the type of queries you have received. So now we will see what all the different types of questions can be asked. There may be many questions, but some of the questions I have given, and what would be the suggested best type of study. So one is like therapy related questions and diagnosis related, ADR related, prognosis, prevention and cost. See, for example, for therapy related questions, randomized controlled trials would be an option, and for diagnosis, prospective blind comparison to a gold standard. So ADR will be again RCT followed by cohort and case control and case series. For prognosis, cohort studies, and prevention again RCT followed by cohort, and cost type of queries, then you will have to do the economic analysis. Now you list out and rank the type of study which is best for collecting evidence-based information. So now take a paper and list out what type of study would be the ranking first, so that you will be getting a best evidence. So you have written it. So now you see what is the according to the modern perspective, the hierarchy of evidence, the first which stands is the systematic reviews, that is meta analysis of critically appraised high quality studies. And then the second one is like evidence synopsis, critical appraisal of a topical or individual study, then followed by comparative studies like RCT, prospective cohort study, retrospective studies, well controlled case control studies, and the least preferred would be like uncontrolled and expert opinions, background and non-human studies, in case you don't get any of the information from the above sources. Now let us discuss a model which would be useful for formulate a clinical questions. What is that model? PICO model. So P stands for patient or population, I stands for intervention, C stands for comparison, and O stands for outcome. So we will see some of the case studies to understand what type of questions can be asked. We have seen therapy related, diagnosis related, prognosis related, prevention related, cost related queries. Now the first case study is on the therapy, that is a physician calls down to pharmacy and asks the pharmacist which medication has been shown to work better for hypertension in a patient with congestive heart failure, whether it is an AC inhibitor or a beta blocker. Now when you apply to PICO model, P will be like patient with congestive heart failure, that is population group, and I is AC inhibitor, and C is that is comparison is a beta blocker. Outcome, what you require is the lower blood pressure. So the cost related case study is that a nurse is asking to a pharmacist, I have a patient who has been on omeprazole, please suggest a cost effective medicine in compared to this omeprazole. So you apply to PICO model, a patient with heartburn, I is omeprazole, C is H2 blocker, and O is the relief of heartburn. So the ADR related queries like does measles and mumps rubella vaccine cause the autism in children? So this question falls under the ARM category, that is ADR. A randomized control trial is unethical, so it would be unlikely that any would be formed. So cohort study would be a better one. So the population group is children over 1 year of age, and intervention is MMR vaccine, comparison is no MMR vaccine, and outcome is autism. So find out some cohort studies to find out the information for this type of queries. In case of case studies related to prevention, like the physician thought that he heard after myocardial infarction aspirin may not improve the mortality. He asked the clinical pharmacist, does daily aspirin really improve the mortality, or is there any evidence on the contrary? So the pharmacist should look for the cohort studies. So how will you apply this model? The population group is post myocardial infarction patient, and I is an aspirin a day and C is the no aspirin, and outcome is improve the mortality. So now based on this studies or the case studies, the quality of evidence is very much important whenever you search for the suitable information to provide it to your inquirer, because the study quality may be varying and conflicting, and some of the studies may be missing data may be there, ADR may not be reported in that particular study. Sometimes the study may be deliberately misrepresented by the people conducting the research. So you just ponder for a while, how will you evaluate the evidence to get a good quality study? That means what are all the criteria any study should possess, so that you will be able to get a best quality study for you to answer to a physician that forms the basis of evidence. So what are all the things? Please list out what are all the important points you will consider while evaluating any particular study. So what are all the points you have written? You please compare it, check whether it is a proper study type for the question you are researching. It should be a clear research question and large study population. Inclusion and exclusion criteria should be listed, and there should be a control group for the study being conducted. Clear defined endpoint should be there, and how the study is being performed, and whether this particular study is information is applying to my patient, or is there any bias is there, is it free from bias, is it a multicentric trial, is it a double blinded study. So all these questions you will have to ask while evaluating the evidence. So once you evaluate these type of getting appropriate evidence, then you can source out those particular websites or the information, primary, secondary, tertiary references. So what are those information where you can get it from information? So I have listed out some of the useful links, that is evidence based medicine useful links, so that you can get suitable information for your queries which are being asked by different inquirers. So these are some of the EBP or EBM links, that is ACE Journal Club, Cochrane database, Dartmouth EBM database, and database of abstract of reviews of effectiveness, Dynamed Plus, e-medicine, and evidence based journal series, BMJ publishing group, and National Guideline Clearing House, and Ovid Medline. And there are databases like Up to Date that is also being used by the physicians. So these are all the important and useful links, the systematic reviews, and good articles are present. So these type of studies you will have to always rely on to take out some evidence based information and provide it to your inquirer. So to conclude this evidence based practice or evidence based medicine, so how to improve your healthcare through the enhanced teaching and application of EBP. So the proper curriculum considerations you will have to frame, and teaching methodology should be sound. There should be a proper educators for EBP, and there should be a stakeholder engagement, that is the patients, policy makers, and healthcare professional. There should be an engagement so that you will be able to get a practice of good evidence-based medicine, and evidence-based practice by the pharmacist will be possible. So there are a lot of information which are available in the internet. We are drowning in information but starving for the knowledge. So try to understand this overview of evidence-based medicine and practice evidence-based medicine in your day-to-day practice. Thank you.